Should I do it again?
You said hi.
I did, but she was talking. Don't interrupt me. Okay. Hello, everybody. Welcome back. I'm Hannah. Do it again. Let me talk, woman. Okay.
I think we should include all of this.
Well,
Enough
we
coffee
should
for
not
you.
pre-record this because it's too easy to do at the beginning of every podcast.
Janine, you hush. You hush. It usually goes really smoothly.
It's my fault.
Maybe Janine should do the intro for this one.
Would you?
Of course. Hi,
Okay, go.
guys. This is Hannah and this is Megan.
Oh, well.
Hi. Ta-da!
Thank you. That was perfect.
Outtake number 7. Okay, now let's do this.
Okay, Megan, do you want to start? Or Okay, will you shut up until I'm done? Okay, cool.
Yes.
All right. Hi, everybody. Welcome back. This is take number, 17. But who's counting? I'm Hannah.
And I'm Megan.
And we have a guest this week. Say hi to Janine.
Hi, Janine.
Hi, guys.
Welcome back.
Yeah, you might remember that Janine was here in season 1. And we're very happy to have her back and to talk about some updates that she has.
Yeah, how'd that bucket list go, babe?
Yeah, exactly. So last season we talked about Janine's bucket list. Her and I talked about our respective bucket lists that we have of things that we want to happen before we have a child. And now I'll hand it off to Janine. Tell us about how that went.
Well, the bucket list. I remember that piece of paper. We wrote something down, and then Hannah and I talked on the podcast, and then, well, I threw it out. I just erased everything on the bucket list. Because as we talked about in the podcast, I started to realize, I started to question myself, is it really worth it to do all the things on the bucket list to wait to start our family?
Mm-hmm.
Well, and I think since then, my partner and I, we were a little bit more loose with our contraception. Is it right? Contraception.
This is
Yes.
feeling like a very familiar story.
I was
Yes.
about to say something. I'm glad you did that.
Oh. And then, well, like the first time we did that, 2 weeks later, I was pregnant.
Oh my gosh.
Ta-da!
Amazing.
Yes, amazing and overwhelming and
Slightly terrifying.
Slightly terrifying. The first impact after I peed on this stick, and it tells you to wait 15 minutes. The
15?
longest 15 minutes.
I thought
of
it's
my
1
life.
minute.
Yeah, what
No,
kind of
it's
test are you
15
using?
minutes.
Jesus.
I don't know. I have a second one and I don't need it anymore, so I can send it to you. You can try. But it takes on this little piece of paper, you have to wait 15 minutes. So I took the test, and while I took it, there was no 15 minutes. It was 2 stripes directly. So I knew, and I was like, I'm I was very afraid for a long time to get pregnant without knowing or without planning for it. So I always had a test somewhere, and I don't know. I think it's not very good for the environment, but I did like 200 tests in my life.
What?
I did this
yeah.
a
Oh my
lot. I did
gosh.
this a lot because I was afraid that something could happen without me
Right.
knowing, and I was very, I tested me a lot.
Yeah.
Right.
And every time I did this 200 times,
Yeah.
one
That is a
stripe.
lot of negative tests to then pop.
Yes.
I'll
But,
find mine.
but
Now I want to speak German because there's 2 Germans in the room.
I know, me too.
But when I took the tests before, I wanted them to be negative all
Right.
the time. Every 200 times, I wanted them to be negative. And this time, it was the first time in my life I would even consider it to be positive for me, to be
Right.
good for
Oh,
us.
good.
And so there was 2 stripes, and I was looking at the thing. I never had that. I never did that. It was one only. Every time, only
Yeah.
one stripe. So, and then I had to wait the 15 minutes to tell my husband, and he's not my husband, but
Yeah.
I don't know. He's not
Partner. Your partner.
Yeah, you can say partner.
my partner. Yes, my partner. And so I cried a little. And it was early in the morning, of course, because you're supposed to use the first urine of the day for this test. It was early in the morning, and I did not tell him before that I would do the test
No.
this morning, because I wasn't sure, and I was like 3 days behind on my period, and I get that a lot, to get a little bit further or with my period, it's not always on time. So, well, I just wanted to make sure, because in the evening we invited friends, and I would have
Had a drink.
some alcohol. I would have had a drink, and I wouldn't do that if the test was positive. So I have to wait the 15 minutes and sat here, and it was like hair all over and in my pajamas, and it was so long. 15 minutes was so long, and then I could tell him. And then we both were like, oh my god, what did we do? It was just this one time, and we were talking about it, and it was a clear decision for us. We went to it with a plan, but we were like, okay, it may be a while before.
Yeah, getting pregnant is supposed to be hard.
Yes.
That's what I keep hearing everywhere.
Yes.
And it is hard for a lot of people. I'm being glib right now. It's very hard for a lot of people, but your experience is just like, you're basically telling a story here, babe.
And maybe, Megan, you can tell it from your side, but I am thankful that it is like this, because I also got the stories from friends who tried for 1 year, who had I don't know, Fehlgeburt?
Miscarriage.
Miscarriage, who had a miscarriage and had to try again, and there are so many really hard stories out there for women who are so wonderful and try to get pregnant, and I could cry when I just talk about it, because it's so hard for some people.
Yeah, it's such
And
an intense process.
Yes,
for
and
so
we
many
just did it like this.
folks.
Okay,
I know.
condom.
Yeah.
We don't need a condom today. Let's see how it goes.
Let's see how it
All
goes.
right.
Let's play
my God.
roulette.
Yes.
Oh, yep.
Yes.
Yeah,
That's
no,
the
I
story.
feel like we cheated or something. I feel like
Yes.
I don't know. I mean, I'm sure that there are many, many stories like yours and mine. But when it happens that quickly and that easily, you don't feel the need to process that much. You don't feel the need to, like, get support on that unless you're, like, really not ready to have a baby. But, yeah, it's weird.
It's really.
I feel
weird.
really, really lucky. Really, really,
Yes.
really lucky.
Yes, we are.
Yeah. Oh, so you're pregnant.
Congratulations!
Yes, it's today. Is on Saturday is the day I get my new week, and it's the 18th.
18 weeks. Oh my
Yes,
goodness.
18 weeks.
Congratulations.
Yes.
Oh, that's so wonderful. So you're out of the first trimester. How was the first trimester for you?
Not good.
That tracks.
In conclusion, it was hard. Very tiring.
Yeah.
For the most part, and yeah.
Was that your main symptom, or were you nauseous too?
Nauseous just a little bit. I was also
really?
lucky in that department.
That's fantastic.
Yes.
But like going to bed at 7 p.m.
Yes, every night. When I have I told in last episode I have a foster child, and when I put her to bed, I would be ready.
Yeah.
I could not wait. Yes, and also every minute I could get, I would lay down.
Wow.
Yes.
Yeah, that first trimester is serious business.
Yes, it is.
Yeah. And did you have support during that time? Did you have people that knew you were pregnant and that you were talking to? Because I know a lot of people keep it kind of close to home during the first trimester.
Yes, and I did not want to do that. So I talked to my partner, and he wanted to do that. He wanted to keep that secret for ourselves, but I compromised with him. I told my best friend, I told Hannah, I told there's a friend of ours. She's already pregnant. She was already pregnant 3 months at this time, so she is 3 months ahead. Yes,
Yeah.
and she was one of the first person I talked to, because I also told Patrick, I have to talk to someone who knows about this stuff. I have to. The first thing I did after I did the test and told him and get dressed, and I went to the nearest pharmacy and get Folsäure. I don't know, vitamins.
Folic acid?
Folic acid, yes, folic acid, and the thing you're supposed to take
Before you get pregnant.
Yes, most people take it already before they get pregnant, and this was my first thing I did. So okay, I have to take this now.
Yeah.
And then I talked to her, because we moved here, and I didn't have a gynecologist around, so I had to look for a gynecologist. I had to look for a midwife, and there's so many things. I really, if Hannah asked me last time on the podcast, do you think you're prepared to get pregnant, and do you think you know your things? And I would have said, of course. I'm so clear on everything you have to do and everything you have to decide.
Mm-hmm.
And the minute I got pregnant, there came reality around, and I was not prepared. And there was a lot of things I did not know about, and I had to decide. And all the testing with the gynecologist, and there's a couple of things I did not know about, and I have to decide. And talking with another pregnant person helped a lot. So
that's so great.
Yes, I went to her gynecologist. I called her midwife.
Fantastic.
I just took over her plan and what she did, because she's also someone. She got the same occupation than me. She does the same thing. We're like, when it comes to children, when it comes to, I don't know, was it Erziehung?
Child education?
Child education. Yes, we're like on the same page. Yeah. So I knew I could do what she does, because
we're so wonderful.
Yes,
that's
that was really good.
Huge weight off.
So I didn't even interview more than one midwife. She told me about hers, and she told me like the basics about her midwife, and I called her. I made my first appointment with her, and it was cool. We understand each other, and
Yeah.
that was really important for me. And it was really important for me to have a midwife early on, because you already talked about it. It's not so easy to get one. And the first question she asked me, when is the baby ready? And I told her, well, early February. And she said, okay, that's fine, because January I couldn't take you. I couldn't take you on.
Wow.
So
Yeah.
and I was like fifth or sixth week. Some women don't even know they are pregnant by
Right,
then.
of course.
Yeah.
And well, I got a midwife then.
Congrats. That's
Yes.
awesome.
Yes, that's really awesome, and she's awesome. I went to her last week again, and yes, that's really good.
That's so cool. What do you do? Do you mind if I ask? What are your midwife appointments like? What do you do when you're there?
Well, she's a midwife who specializes in the care after. So you can go to a midwife before the baby comes, before the baby comes, but you're supposed to, or you're probably would go with all of your problems to the gynecologist.
Okay.
So you have a gynecologist appointment every 4 weeks. If you're not if there's not something special, you have an appointment every 4 weeks, and till the end of pregnancy, it gets smaller. The
increments.
Yes.
Yeah, you start going every 2 weeks, and then when you're really close to your due date, you go every week. That's the same. That's very similar to here.
Yes, and there are things you can do with your at your midwives if you want to. So and the Krankenkasse,
The insurance.
the insurance pays the appointments. So
That's great.
Yes, I went one time to her to, well, just get to know her, and we went on vacation, and I had a lot of questions about that, and well, we just talked. And last time I went to her, it's not like I have a standing appointment. I have to call her if I have something I wanted to discuss with her. And last time I had issues in my lower back, and she taped me with
cool.
kinesio tape. Yes, that was really good. And yes, and I can always she always tells me, and my friend, she tells her too, we can always call, we can always do messages by WhatsApp, and like she also said, well, you can take a picture and show me everything. There's nothing I haven't seen. So if there's anything you're worried about, take a picture, show me. We can talk about everything. So she's really cool. And
That's really cool.
Yes, I want to. We have. I also booked a class for me and my partner to how's it in German?
A birthing class, like a childbirth class, childbirth education class.
Yes, this, and we will take a weekend course in December. I hope if COVID allows it, then we can take this class. But if we take this class, or if we don't, I want my midwife to talk to my partner about the birth and everything that happens after the birth, like the weeks. Postpartum, yes. I wasn't really informed about postpartum before. I knew about it, and I knew it was important, but I didn't know the specifics. And it's really hard for me to tell my partner about it, because I'm also learning just about it. And he's always like, but maybe you will, maybe after the birth, you will be totally fine and you don't have to lay down. And yes, if I am totally fine, then I have to lay down and then I have to take care of myself and of the baby and can't do a lot of things beside that.
Right.
If I'm not fine, this is a whole different conversation.
Right.
So he doesn't get it right now, but he will. And I think if my midwives talk to him, she will explain it to him better than I could.
Yeah, I think it's always easier to hear something that you don't necessarily want to hear or would find difficult to take in from someone that's not your partner.
Yes. Yes. And
I know
also
that
she's a
a
healthcare
lot of times
professional.
I'll say a lot of times I'll say something to my partner and then like 2 weeks later somebody else will say it to him and he'll come back and be like, "Oh, I heard this thing today and it really," and I was like, "Okay,
Yes.
hold on though. I said that 2 weeks ago."
Same here.
But I think that's just normal, and I'm sure that it happens
Yes.
the other way around too, right? Because
Yes.
they're just someone that, I don't know, for some reason it's hard to take in. I think because we talk, because we talk so much, it's hard to take everything in with the same weight that you would take it in a different context, and then your brain is in a different context, and then everything is different.
Yes.
That's awesome.
Also, I think it's kind of hard for the man in the pregnancy to get it.
Definitely.
It's your body, your hormones, you're changing from the moment you holding this stick.
Yeah.
Everything is different.
Yeah.
But not for them. At first they can't even see it until the belly gets bigger. It's a little bit of time. It's just right now that people talk to me like, "Well, you're pregnant, so we can see." But for the last weeks, you couldn't tell.
Yeah.
So
Yeah.
they did not. There was no change for him.
Right.
Yes.
Right. Except in thinking, and that's really hard to
Yes.
be real.
Yes. And of course, he had to, see me a lot of sleeping and crying and eating.
Right.
It's such a huge thing, right? So many
Yeah.
things happen in the body. And I think even as the pregnant person, as the birthing person, it's such a huge concept to wrap your head around and understand what's happening.
Yeah.
And you are feeling the things, like you are tired, you have more appetite, you are nauseous. So that connects you to the information somehow that there's something happening. But like you said, your partner is only seeing you sleep. Like he's not even seeing it at first. The belly doesn't grow. He's not feeling the things that you're feeling inside your body. And same after birth. He's like, okay, now it's out. Cool. And he doesn't connect to the theory that the uterus has to grow back and all these things need to heal and your body's making milk and it's making blood because you lost a lot of blood during birth. And the hormonal changes that go with the all of the healing and making the milk and the change from having a baby inside and now having the baby
so much
outside.
Sweating. Just the sweating is unreal.
I
The
heard about
sweating
it.
is really the highlight for postpartum for me. I was so hot all the time. I was just so hot. So hot.
And then you have to attach this other human person that's also like has temperature to your body all the time.
Oh my
bet
gosh.
that's also great.
24/7.
I was naked a lot. There wasn't a lot of clothes.
Right. So it's difficult for everyone to grasp, but then I think it's understandable even more so for the one that is not experiencing it in their body. So I have a lot of sympathy for the partner being like, but would you really need to be lying down for weeks. Like, why? How? I get it. But I also get the frustration from the pregnant and birthing person to be like, yes, I really need to, and I would really like your support. Thank you.
Yeah.
Yes. And I might add, if you're building a house and having a foster child who is going to school for the first time in her life, all at the same time while being pregnant and tired and hormonal and getting really, really, really emotional about food.
Oh.
I'm crying. I'm crying if I'm hungry. And if there's
Yeah.
no food, I never experienced this in my whole life. I always could wait to eat. Now I can't. I
No.
really can't. And if someone is suggesting I could wait, he or she gets the rage. It's not good.
I get the rage.
Yes, and I'm not crying. I'm not crying like a little bit. Sorry, I'm hungry. I'm like ugly crying, screaming. It's really.
I love it. The whole show.
So your
It's
snack
the whole
organization is going to be tip top on point.
Yes, I can't leave the house without at least half of an apple or some energy bar or something in my purse, because it could get, bad really fast.
Real bad, real fast.
Yes, like really hard crying. It's,
Oh.
yes.
I have a fun question really quick, and then I have a intense question after that. Since we were talking about food and always needing to have a snack on hand, have you made any new, fun, crazy, interesting discoveries food-wise?
Not really. It's
Not yet. Okay, we'll check back in.
Nothing that is funny. It's just like things I always liked. I always wanted to eat. I always had a taste for. It doesn't taste anymore. It doesn't fit me anymore. I doesn't. We are invited to friends, and there's a lot of food on the table, and it's like I'm tasting a little bit of this. No, that's not for me, and putting it on the plate for my partner, and it's like 15 times, and now he's got the belly and I'm hungry always. I don't know. It's weird.
So finding
also
something that
pregnant
you
a little
like
bit.
is also kind of a
struggle. Yes.
Yeah.
Yes.
I hear that a lot too. I think that's common, isn't it?
Yeah, I think so.
I think smell and taste is intensified.
Has your sense of smell gone crazy?
Yes.
My sense of smell was like I could smell you coming from 200 yards away.
Yes. I if someone it's a little bit funny. If someone farts in the room and I go to the room, I don't know, 20 minutes later, I'm like, someone farted. I know. And I ask around, how dare you? I'm pregnant. I can smell everything. Go outside.
Oh, wow.
They're like, it was 20 minutes ago.
Yes.
Oh,
Yes.
that's funny.
Okay. So let me
Segue.
take it, from farting. That's a wonderful fart way. That's a wonderful segue. Okay. In the beginning of your pregnancy, you and I talked a lot about you're a gynecologist, and there was, I don't want to take too much ahead. Do you want to share about that a little bit?
Yes. I told you that I'm very grateful that the pregnancy was, getting pregnant was so easy. And I was very happy, and we both were very happy when the 2 stripes on the test thingy went pink, and, well, everything was fine. And I talked to my friend and got an appointment with her gynecologist. So I went there, and it was like the fifth week, I think. And on the ultrasound, you couldn't see the baby yet, but the gynecologist told me that was totally fine, totally normal. You only would see just a little blob,
Dot.
a little
Yeah.
a little dot was there, and what she could tell me was it is in the right place. So congratulations, you are pregnant, but we have to wait 2 weeks to see if there's
Check the
something in
heartbeat and
it.
everything.
Yes, check the heartbeat and everything. So the week after that, I started bleeding a little bit, and they told me, and I don't know, I think a lot of people do not do that, but I am one of these people who does this a lot. I Google. Every information was, if you're bleeding, you go to your gynecologist right away. And so I went there, and the woman who did my appointment the first time, she wasn't there. She was on vacation, so I had to go to this doctor, some guy, and he really was in a hurry. He didn't have a lot of time for me, and he wasn't empathetic, and he was, well, and I thought at this appointment, I thought, okay, I came in with an emergency appointment, and someone in his team is already on vacation, so of course he does not have a lot of time for me, and so on. So he did an ultrasound, and he did the ultrasound really fast, and said, okay, there's some bleeding in the uterus. That could be fine, and it could be a miscarriage. We don't know. You have to come back in 1 week. What he did not tell me at this point, and I think I remember it really clearly, the appointment before, at the 5th week, I could not see the embryo. It's embryo in English? Fetus? I don't know.
Yeah. Fetus is later, but yeah.
Yes, okay, I could see it, and the appointment with this doctor, I think I saw something in the dot. There was a baby in there, and he did not tell me about it, and he did not give me the picture to take home, so I did not have this picture. But I saw it, and I came home, and I was really sad about what he said, because he did not explain a lot. He just, well, could be fine, but could be miscarriage.
Yeah.
Who knows? You have to come, you have to wait 7 days, and then you can come back, and we make a second ultrasound and see what happens. So then I went home, and I was sad but positive, because I saw the embryo. I saw something in the little bubble, and I told my boyfriend, I told my partner, well, there was something in it. Okay, I'm bleeding, but it could be fine. And the bleeding stopped at the same day. It didn't go on for longer, so I was pretty
That
sure.
feels encouraging.
Yes, it felt very good. So a week later, I had a new appointment, and it was a planned appointment. It was not an emergency appointment. And I had the same doctor as before, and he still was in a hurry. He still was very fast. He still was very impatient with me. He still was not explaining anything, and very, well, discouraging and not empathetic with me. So he did another ultrasound, and he does ultrasound so fast. It's like when I always tell my German friends, like when I sit in a car and I have to, I don't know,
gears.
I have to shift gears. It's like this, and then it's 3 seconds and he's out with the ultrasound. So
Oof.
yes, it's not.
And this is an internal, not to get too personal, but this is internal, right? This is an internal ultrasound with the wand.
It was an internal ultrasound, yes. So he took the thing into me.
That's not the guidance.
No, it's well, the process itself was not fine with me
Mm-hmm.
how he did it, and the conclusion he took from that was even worse, because he just took 3 seconds to look. He just did it like dang, 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 and was finished. And then he said, well, there's nothing in it. It's empty.
What?
We have to see you in a week, and then we can talk about an abortion. So everything gets out if you have a miscarriage. The rest, the uterus and everything, it has to leave the body. So they would do an operation. So I was crying.
Yeah, I'm so sorry, Janine.
It was really hard, and he did not explain anything to me. He just went, and I sat there, and it was like my appointment was at 9:15, and I'm a very punctual person, so I went early, and at 9:15 I already was back in my car crying with no explanation and no. Yes. Well, and then there was a lot of fear with this miscarriage. And my partner, who also wouldn't know what to do and wouldn't know how to help me.
Mm-hmm.
And I was very sad, but I also got very angry at him. And I called my midwife, who thank God, I did not tell you about. There was another conversation with her. I called her, and I was so grateful. I had her already. It was just week 6, week 7, but I already had a midwife. So I called her, and she was furious at the doctor with me, like 2 women talking about this horrible man and his technique. And she also said, like, I know a lot of gynecologists. She's a midwife, so and she also she does not only visit the women when they're at home. She also works in a hospital. She knows what she's talking about. Also, she has 2 children of her own, and got through all of that. And so she told me, I know a lot of gynecologists, I know a lot of doctors, and if he only took 3 seconds to look for a fetus, I don't know, maybe he is that
He
good.
had decided coming in the room that you had a miscarriage.
Yes, he decided the week before. And he didn't
This is so unacceptable.
Yes. And if you spin this idea, if I would be a woman, some person who would not call her midwife and not got a second opinion, this was what I did. I may have had the appointment for the operation without even needing it. So this doctor, I don't know. He shouldn't practice.
Yeah. Were you
That's
able
it.
to call the office and
I couldn't bring myself to it
Yeah,
until today. I couldn't, because I was thinking about, I don't know, it's a little bit naive, but I was thinking about a bad Google review. I was thinking about, well, I told everyone I know about this, and friends I know will not go there anymore. There are other doctors in his team, but no one I know will go there anymore because of this horrible man. And, well, back to my midwife, I called her. She was furious with me, which helped a lot.
Yeah,
Someone
good.
who
Yay.
would be angry with
love a
me and would be,
midwife.
yes. And she told me about her gynecologist, where she got her 2 babies, and she would send me there, and she would tell me she's an elderly woman. She's, I think, I don't know, she may be, I don't know, was Rente in
Retired.
retirement? Yes, she is just a couple of years from retirement, but she had so much experience, and my midwife also told me she does not have the newest equipment or the biggest, best ultrasound, whatever, but she will find your baby.
She has heart.
Yes. And she did. And I might add, it also took only 3 seconds.
Wow.
She did the ultrasound in whole longer than the horrible doctor, but it only took 3 seconds and she had my baby. Yes. Yeah.
Thanks
There's
for
a lot
telling
of
that.
emotion
Yeah, thank
Of
you
course.
for sharing
about
that.
this. Yes, of course.
What an experience to have in week 6.
Yes.
Yeah.
Yes. And I told you I'm someone who Googles a lot, and I also Googled this, and I discovered it happens a lot.
Yeah.
It happens a lot that women get told there's a miscarriage or there's no baby. And I also heard, I read about women who made the appointment in the hospital to clear
out
off
the
everything. And they came there and they had the emotional roller coaster of getting to this point in this pregnancy to think there was a miscarriage and I couldn't do it, whatever. And then there was a last ultrasound before the operation, and they would tell them, well, no operation, you are pregnant, everything is fine.
Oh God.
And to put women through that, you can't do it's not fine. It's not okay.
It's not okay.
Yes. And yes, there are some really shitty doctors out there. And
Yeah, it turns out doctors are also humans.
yes.
There's really
Yeah.
great ones and there's not so great ones.
And I
Yes.
want to bring it back to the system too, that the system that we have in place is making it really difficult for doctors to take a lot of time with every patient.
Yeah.
Yes.
So of course that doesn't excuse this behavior, but I
this
always
seems
find it
exceptionally
important to point that out,
Yeah.
that we need a change in the system. Like Janine was very lucky that she had a midwife, as she said from the beginning, and that this midwife could help her through that and get her a new doctor and talk to her about all the things, so she wasn't alone with just Google.
Yeah.
And many pregnant people don't have that, and that's a problem. And that
And you're
problem
not
again
supposed-
is with the system, because midwives are paid like pretty much nothing. So there's it.
Especially
you have
compared
to
to
really
a gynecologist.
Yes.
So you have to really, really, really want to do that job, and pretty much in every case have a partner that earns well and can support you and the family. So yeah, the whole system could be set up better so every
Yes.
person has a midwife that can take the time and has a doctor that can take the time, because they also get paid a little bit more from the health insurers and don't have to
Yeah, or they
do
get paid differently. The at least in the US, the way that they're paid is disincentivizes them spending more time with patients.
exactly.
Yes.
If they were
Yes.
paid for different things, if they were paid
Yes.
for a conversation
Yes.
rather
they are
than
not paid for
a
talking to you.
procedure,
Mm-hmm.
then they would spend their time differently, and they could spend their time differently. And,
Yes.
you know, there are great doctors who spend their time differently at the expense of billing that procedure.
Yep.
but they're making that decision very, very consciously and against a lot of the pressures that are within the system that they're working in.
Yeah.
And while it's unfair to expect pregnant people to be fighting against a system constantly, it's also unfair to expect doctors to be fighting against the system constantly, because then we're all just feeling like we're going against the flow or against something that is really, really powerful.
Yeah.
Because you're also not supposed to question doctors because they're the expert. And you want them to be the expert, right? Like,
I was going to say, yeah.
You really want that information to be correct and valuable. And again, that's a lot of pressure to put on a human.
And that is also harder with this small amount of time for them to be the expert. Yeah. So much harder because they have so little information because they don't have the time to get
and so they're used to making these big decisions really quickly because they have to make a judgment and be right. And so they have to believe it.
Yeah.
And they have to communicate to you that they thoroughly know what they're doing so that you trust them. And if you didn't have the confidence and the self-awareness and the wherewithal to claim another opinion, to be like, no, this wasn't right. Because a lot of people wouldn't have had that. They would have been crushed by this experience and then just been sad. And like you said,
and
the woman that went along with it and showed up for her appointment.
You're not supposed to get a different opinion. It's your insurance is not covering the different opinion. I had to pay the appointment with the new gynecologist by myself, because you're not supposed to change your gynecologist. You can, there's an exception, you can until the end of every 3 months, until every quarter, but you can't just change how you want. And so I was lucky because for me it was just one appointment. I had to pay by myself. And it was worth it. I would have paid double. It was totally worth it. But it's crazy. There was this doctor who was not treating me right, and his opinion, his expertise was not the right one. And I had to get a different opinion, and I had to pay this.
Wow.
Yes.
Yeah. I'm really, really glad it worked out. I'm really, really grateful that you had that midwife, that you found a doctor that you feel safe with, that took the time.
Yeah. Yes. And even if it had been bad news, someone that could interact with you with respect and care and empathy. And understanding that this is a big deal and not even in the 5th and 6th week, because like you said, some people don't even know they're pregnant and then they get their period and
it's fine. Yes.
Right. But
that's another reason why it's so important to have a midwife, that everyone can have one, so you have someone with you when you have a miscarriage that's by your side, that's helping you through it. And the partner and everyone that needs support in it.
Yes, and I think that is the reason why so many people don't tell their friends and family up to the 12th week that they are pregnant, because the possibility of a miscarriage is there for everyone. There's a percentage of miscarriages happening. But I don't know, with you guys, with your friends and family, no one talks about it. No one wants to hear it. No one wants to. And my opinion on that, even before this whole thing with the bad gynecologist, was if I'm having a miscarriage and if I am feeling it as a miscarriage, as Megan said. If you're not even knowing you're pregnant and then you get your period, it may be not as disturbing for you, or you may not even be aware that there's a miscarriage happening. I think this happens a lot, and we women don't even know about it with your next period. And it's your body is a good system. you have to trust that it just wasn't the time for it, or it just wasn't the right, I don't know, genetical combination that was good, that we will need in the world, whatever. But there is the possibility, and you have, and for me, if I would have, I would have liked people to know, because I would have been sad and I would have been emotional about it, and I would have liked to get the support, and I would have liked to, well, people to understand me.
Yeah.
Yes.
Absolutely.
And I'm so very happy and so very grateful that it did not happen, and that I'm week 18 right now. Yes, it's so great, and I'm so happy.
Yeah.
So you told your family and friends early on, how it was a really cute story, how you did that. You want to tell that?
Yes. Our family, Patrick's family, he had to bring the message, because his team, he had to tell them, and we told them kind of one by one, and it was really nice, and for me it was so nice to see how proud he was to tell everybody. So I'm gonna be a dad. So that was really nice. And with our friends, or with a big group of our friends, we did this thing. Well, in the last year, or last couple of years, there's a lot of things happening for us. So we started building our house. I got 30 this year, so the big 3. And
whoop, whoop.
Whoop whoop, yes, and I'm very happy about it. And there are a lot of things we could not invite people to, because of COVID, or because of the house, because we just not, it was just no time, or it was just forbidden, or anything. So I did an invitation for everyone for our big party, and I did like you can cross on what you want to party this day. So there we did like, there are a lot of reasons why we should have a big party, where we should celebrate. So you can decide what you want to celebrate with us. Just pick your theme.
Pick your poison.
Pick your poison and come on this date, on this hour. So, and no one of these people knew that I was pregnant, and I just put it on the list. So there was, our house is ready. Janine would be 30. Well, and there were so much reasons, and I just put Janine is pregnant in there. And everyone was reading the whole list, and well, party, yay, cool. Well, Janine and Patrick invited us. Well, wait, Janine, you're pregnant? And then everybody came and hugged us and wished us well. And also there was another person, another friend of ours, and they're having their 3rd child. And no one was expecting them also to be pregnant, but they are, and they have the same date. The same date as we. Yes.
That's so fun.
Yes, that's really nice. We are always texting like, how is it with you? 18 weeks.
We're doing it.
Yes.
Oh,
so for anyone that is still looking for ideas,
that's a great idea.
Yeah, I thought so. So there you go. You're welcome. Another idea. Thanks, Janine. Very creative.
Yes, I'm very proud of the idea.
Yeah, you should be. It's a great idea.
All right. I think we have a few more minutes for one more topic that you two were talking about earlier when the microphones weren't on. So let's do that, and then we should wrap up, I think.
Okay, what was that topic?
Pregnancy
Yes, please
dreams.
remind us. Pregnancy dreams.
Pregnancy dreams.
And go.
Oh my gosh. They're so intense.
Weird.
And
Yes.
so weird. Mine were like full-on cinematic movies. Like,
That sounds fun.
I would wake up and tell Hunter about the like rescue that we had to go through, and like running through buildings and chases, and it was so vivid. It was like when I woke up I would have to remember what real reality is.
Oh, wow.
Yes. Yes.
Like, very intense.
I feel you.
Have you been having those too?
Yes, yes, yes. And it's sometimes a little bit. I had this one dream. It was a little bit like you said, like horror movie.
Oh,
and
no.
and I told my partner the next morning, and he's just standing there, and you should write that down. We could make a movie from that. Yeah. It's really really interesting to. Well, your dreams. But I also dream of like people I don't even have in my life anymore. Like years and years, like elementary school. I dream of these people, and everyone who ever in the last 30 years was in my life is in my dreams, and I wouldn't even have a telephone number or an address or
Yeah,
I
people
didn't-
that you just don't know anymore.
Yes,
Yeah.
everyone. And like you said, they're so vivid. It's like reality. You get up and you have to, okay, where am I? Okay, I'm safe. There's no ex-murderer like behind me. Let's look at. Yes. For me, there was a couple of dreams really bloody and really hard. But most of them are just like, and people who wouldn't go together. In my dream, it's weird, really weird. Yes, and I kind of hate them because I really need the sleep.
Yeah, it does feel like you've been up all night because it's so vivid and you remember it so well.
Yes.
Yeah.
And also there are nights, there is not just only one dream, like 3 dreams.
Yeah.
You go into different stages, and yes.
Yeah.
Ew.
How's your sleep otherwise, though? Are you able to like sleep through the night and whatnot?
No, because I have to pee every 2 hours,
Yeah.
at least. And I try to not drink as much in the evening. I try to do it more like midday.
Yeah, I don't know that it matters how much you drink.
No, it does not. It's
Probably better to
doesn't.
keep hydrated and.
Yes. And it does not help.
Yeah.
Oh, man.
Do you fall back asleep though, or do you have trouble falling back asleep after you wake up?
No, I don't have trouble.
That's good. That's really
Yes.
good. I think that was
It's-
more toward the end of my pregnancy. I think it was like I would wake up at 3 and then be awake until 5:30
I heard about that.
and then fall back asleep.
Oh, gosh.
When I go to pee, it's like I open just one eye. I go like
Yeah.
this to the toilet, and when I'm sitting, I close both, and then just one back to the bed, and then just.
That's really good. That's
Yeah.
that's a smart. I think that sounds really familiar. As you say that, I'm like, oh yeah, I didn't turn on lights.
Yes.
I just walked and
Just
yeah.
sleepwalking to the toilet and back to the bed. Yes. Did I wash my
All of
hands?
this is making me pee
Did
really
I
bad.
not?
Making me need to pee really bad.
Well, I hope you're not peeing onto the floor.
No, try not to.
But maybe we should let you go pee.
Thank you
Yes.
so much,
I want to
Janine.
talk to you so much more. Maybe we can have you on later in your pregnancy and talk about the whole stretch of it. Would you be up for that?
Of course. There's so much to talk about, and
Yeah, I said to Janine, she'll be back once every season. We'll...
Yes. With every stage of my child, there's a joke I said to Hannah. about just being pregnant so I could be on the podcast again. So that's one of the reasons. So there was another point on the bucket list, and
Perfect.
yes.
Well, we keep trying to get Hannah pregnant to be on the podcast, but we just let her on anyway.
I was going to say, thanks for letting me be here anyways. I appreciate it.
You're integral to the whole process. Don't worry.
Yes.
Janine took over my role. I was like, girl, I can't do it yet. Can you do it for me? She did. She came through.
What are friends for?
She's so
Thanks.
dependable.
Yep.
What a joy. Oh, thank you so much for being here, Janine.
Thank you so much for having me.
Yeah.
Thanks
And
for
we
your
can't wait
time.
to hear
Thanks for
how-
opening up about all the things.
Oh,
Of
yeah.
course,
Thank you
of
so
course.
much.
Yes. Women everywhere should talk about these things.
Yeah.
You should not stay
Amen.
alone with this. You don't have to go on a podcast and talk about your feelings, but talk to your friends, talk to your mother,
Yeah.
talk to your mother-in-law, talk to, I don't know, other women, men, I don't know,
Yeah.
whoever is in your circle and whoever you trust, because it's hard to stay alone with these things. It's too
Yeah.
hard. You can bear it on your own.
Yeah. That was nice.
Amen.
As closing words.
All right. Bye.